Senator, go ahead.
Thank you, Mr. Wyden, and thank you, Dr. Murthy. Man, just for a second, you and I are going to be doctors once more in a literature kind of review session, okay? There is an article that just came out, Literature Review and Meta-Analysis on the Effects of Lockdowns on COVID-19 Mortality, Studies in Applied Economics, coming out of Johns Hopkins. Prestigious institution, prestigious, well-accomplished authors, and doing a meta-analysis of, I think, 16 different studies. In fairness, it's not peer-reviewed, but it's pretty good. Now, a couple things. They spoke about non-pharmaceutical interventions. And one thing they say, they use it to describe any government mandate which directly restrict people's possibilities, not including information campaigns, mass testing, social distancing, but including closing schools or businesses, mandated face masks, etc. So pretty broad. Now, they found no statistical correlation. Let me read the second paragraph of their. With this meta-analysis concludes that lockdowns have had little to no public health effects. They have imposed enormous economic and social costs where they have been adopted. In consequence, lockdown policies are ill-founded and should be rejected as a pandemic policy instrument. Now, we speak of science guiding what we do. Clearly, we've seen that children have suffered, both in terms of learning loss and the lack of a detection of their possible mental health issues, physical health issues, etc. I think I know that you've opposed school shutdowns. Is that a fair statement? And what do you think in general of what these economists out of Johns Hopkins suggest, that what government has done, well-intentioned and without having facts, but in turn, as it turns out, worsened the situation, particularly for child mental health, as opposed to improving? And by the way, Mr. Chairman, I'd like to submit this for the record.
Yeah, without objection, also I'll put into the record at this time, in January of this year, 2022, 95% of public elementary and medical schools were open and engaged in in-person learning, compared to 46% of schools in January 2021. So just wanted to put both of those documents into the record at this time. And then I believe Dr. Cassidy had a question for Dr. Murthy.
And you're going to extend my time, right?
Yes, absolutely. Absolutely.
Took 15 seconds.
And we're going to get Senator Hassan and Senator Warren in with a little lock. Oh, okay.
Senator Cassidy, thank you for that. And I always appreciate our opportunities to talk as doctors and to think about medicine in a human way. I think we've learned a lot during this pandemic. And I think one of the things that we learned early on is that in 2020, first year of the pandemic, where there were many blunt measures taken, like taking kids out of school, for example, being the most clearest example, what I think we've realized is that, yes, those did have significant harms to our kids. My two kids, were among the millions of children who were not in school in 2020 as a result of the pandemic restrictions. Let me tell you, it was hard on my kids. It was hard on their family, on my wife and I too. But now that our kids are back in school, and as of fall 2021, and +% of children or schools were open for in-person learning starting in fall of 2021, that has had an enormous benefit to our kids. And I think our responsibility is to keep learning from the data, learning from these experiences, to approach these types of public health emergencies with a scalpel rather than with a blunt axe.
I agree with you. I'm limited time, but let me just assert, should there be another variant which is more, maybe as infectious but more virulent than Omicron, we need to learn from this and not claim it as an excuse to shut down, but to recognize that best evidence is that the cost-benefit ratio, it's too costly for the marginal benefit. Is that a fair statement?
Yeah, so I think we should do everything possible to keep our schools open. Even with Omicron, Senator, even though it was more transmissible, we were advocating for schools to stay open and to use a safety measure.
So if there's a shortage of testing, as there is currently a shortage of testing, nonetheless, would a school feel comfortable, the best science suggests they should stay open even if they cannot test?
Well, so if a school does not have access to safety layers of precaution, whether that's tests, masks, if they're worried about the ventilation, if they don't feel that it's safe.
But the non-pharmaceutical intervention did not find benefit from those measures. And you're hedging a little bit, Doctor.
No, well, let me tell you, I'm giving nuance here because this is a nuanced thing. It's not black and white. Like if to get kids back in school, you need teachers in school too. If teachers are worried about their health, if parents are worried about the health of their children, then you need to have a conversation with
I
them.
accept that, but doesn't it seem wise that the federal government be consistent in their message to those teachers so that they, like a clear bell ringing, the single note is you can safely go back to school and the cost-benefit ratio favors being in? Because you certainly get mixed messages from the federal government, I'll say that.
So, Senator, I would agree, and I would.
Can I jump ahead because I got
Please,
more
go
thing to
ahead.
ask?
Of course, sir.
Because we actually, on this change topics, Medicaid provides a heck of a lot of mental health services for people. The quality data we get from states, shall we say, is not sterling. It is awful. I'm a gastroenterologist. You can imagine which term comes to mind. So my point being, that's something we have control over, which would be to demand that states comply with something that was originally in Obamacare. I think it was Obamacare, right? TMSIS? Comply with TMSIS in terms of getting good data on longitudinal outcomes for the children they have identified with mental illness, receiving Medicaid reimbursement for either that or addiction services, and to see how that state is doing. Knowing that's beyond your purview in one sense, but is that a policy that you think would be wise?
Well, Senator, I do think a lack of data is a huge problem. It's like you're flying blind if you don't understand what's actually happening in your community. So I think any steps that we can take to ensure we have accurate and timely data will help us to better sharpen our policies. So,
and Mr. Chair, just because it's to you I'm speaking right now, of course, because you're the man with the gavel, I hear anecdotally around the country that psychiatric services for Medicaid patients is extremely poor. Both absence of providers, absence of good follow-up, et cetera. It may not be true, but we only know it until we see the data. And what we can do collectively to demand the states actually put it forward, because we've given them resources, is something we should do. I'm way over. Thank you, sir.
And Senator,